Hi everyone, my name is Cameron. I'm the co-founder and CEO of Hollo, and I'm going to tell you about what we do. So Hollo is actually a B2B platform that develops a clinical tool like digital therapeutics to help treat patients facing chronic illness and the behavioral lifestyle side of things. We make it quite unique in having a sustainable health plan due to our unique AI and behavioral health. So a lot of people that develop chronic illness actually form mental health conditions, and it's highly comorbid. So that means they both impact one another. And since this economic and social impact is so high, we found that this gap really needs to be filled, especially in Asia, where a lot of the care programs in hospitals and outpatient clinics don't make considerations for behavioral health and how that might impact their condition, despite what studies show. And so what we did was our developed DTX actually facilitates alongside of existing therapies, whether it's oncology or GPs, and we actually deliver it through this channel. And since it's highly scalable, what we did was we focused on our digital therapeutic being powered by a backend of active detection, passive detection models and assessments and tracking, allowing our AI models to help create a USP for ourselves. And so it's facilitated between the patient app and the provider platform focused on the communication and collaboration between patient and doctor. And so what we developed was a depression assessment tool using video to help analyze someone's depression level through deep learning. We have a passive behavioral tracking model through digital phenotypes, looking at digital footprints and GPS pattern locations and proximity Bluetooth, and finally driving towards the digital therapeutics program, which is 10 to 16 weeks, focused on improved patient outcomes and a lowered cost of care, followed through a regulatory pathway in the US and Europe, but free to operate in Asia for the most part. And so what we do is we're actually pay per use for our digital therapeutics or using our AI for different healthcare providers. And so we actually pay per use per the pathway, looking for the repeatable reimbursement through the insurance or payers in the market in healthcare. And so we see ourselves integrating into many different fields. We're focused on the clinical validation first as one of the de-risk factors of our startup. And so our team's made of myself with biotech background and science background. Ajit, my co-founder, has got a background in software engineering, and at the moment we recently are changing our team over, so we're having a much more uh, validated and clinically uh, experienced. And so we have PhDs coming in as well as master students to help develop the modules as well as the data science backend. And with a kick-ass advisory group as well, focusing from psychology to business and entrepreneurship as well. And so if you're interested to work with us, let me know, and looking forward to hearing from you.